Welcome to the Health by the Minute podcast. Today's segment, Diabetes 3,000 years ago versus today. Welcome back to Health by the Minute, where we explore health topics, both old and new, in bite-sized pieces. Today, we're taking a fascinating trip back in time, over 3,000 years ago, to understand how a condition we now know as diabetes was recognized and managed by ancient civilizations. It's a story that highlights both the enduring nature of certain health challenges and the incredible progress medicine has made. First, let's quickly define what we mean by diabetes today. In modern medicine, we generally talk about two main types, type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Insulin is a crucial hormone that helps sugar, or glucose, from our food get into our cells for energy. Without enough insulin, glucose builds up in the bloodstream. Type 1 diabetes typically develops in childhood or young adulthood and requires lifelong insulin therapy. Type 2 diabetes, on the other hand, is far more common. It's characterized by insulin resistance, meaning the body doesn't use insulin effectively, and eventually, the pancreas may not be able to produce enough insulin to keep up. Type 2 diabetes is often linked to lifestyle factors like diet and lack of exercise, and it typically develops in adulthood, though it's increasingly being seen in younger people. Now let's step back 3,000 years. Imagine a world without microscopes, blood tests, or sophisticated diagnostic tools. How did people even notice this condition? The earliest written records that describe symptoms consistent with diabetes come from ancient Egypt, as well as from ancient India and Greece. The Egyptians, around 1550 BCE, described a condition they called awa, which translated to the passing of urine. They noted individuals who experienced excessive thirst and a large volume of urine, often leading to emaciation and death. These are classic signs of uncontrolled diabetes. In ancient India, around the 5th century CE, physicians like Sushruta and Charaka provided more detailed descriptions. Sushruta, a renowned surgeon, identified the disease and even noted its association with sweetness in the urine. He called it madhumeha, which literally means honey urine. This is a crucial observation, as it hints at the high sugar content in the urine. Physicians would sometimes even taste the urine of patients, noting its sweet flavor, a practice that, while unhygienic by today's standards, was a key diagnostic clue in the absence of laboratory tests. They also observed that ants were attracted to the urine of these individuals, further confirming its sweetness. The ancient Greeks also recognized this affliction. Aretaeus of Cappadocia, a physician in the 2nd century CE, gave it the name diabetes, derived from the Greek word for siphon, or to pass through, referring to the constant flow of urine. He also described the extreme thirst and wasting away of the body. So, how did they diagnose it? Their primary diagnostic tools were observation and deduction. They looked for a cluster of symptoms. Polyuria, the excessive urination, often in large quantities. Polydipsia, the extreme thirst that accompanied it. Polyphagia, increased hunger as the body's cells were starved of glucose for energy. Unexplained weight loss. Despite eating more, individuals would often become very thin and weak. Sweetness of urine. This was a critical observation, especially in ancient India, where physicians would literally taste the urine or observe the attraction of insects. It's important to note that they wouldn't have distinguished between type 1 and type 2 diabetes as we do today. They simply observed a set of debilitating symptoms that often led to a grim prognosis. They likely saw different presentations, some perhaps more acute and rapidly progressing, more akin to type 1, and others more chronic, perhaps more like type 2. But without the understanding of underlying mechanisms, they were all grouped under the same umbrella of honey urine, or the siphoning disease. Now let's talk about treatment in ancient times. Given their limited understanding, treatments were often empirical, and sometimes based on what we might consider folklore or guesswork today. However, Some approaches showed a degree of insight. The primary ancient treatment for diabetes was dietary modification. Physicians recognized that certain foods exacerbated the condition. They advised patients to avoid sweet foods, grains, and rich foods. Instead, they recommended a diet of barley, legumes, and certain vegetables. This is remarkably similar to the dietary advice given to people with diabetes today, focusing on controlling carbohydrate intake. The emphasis was on moderation and avoiding things that would feed the disease. Exercise was also sometimes recommended. The idea was that physical activity could help the body utilize its resources better. Herbal remedies were also a common approach. Various plants and concoctions were used, though their effectiveness was highly variable. Some might have had mild diuretic effects, helping with the excessive urination, while others were likely ineffective. There's no evidence of anything resembling insulin therapy, of course, as the role of the pancreas and insulin wouldn't be understood for millennia. The prognosis in ancient times was generally poor, especially for those with more severe forms of the disease. The condition was often seen as a curse or a sign of divine displeasure. While some individuals might have lived for a period with managed symptoms through diet, many would succumb to the disease, likely due to complications like infections, dehydration, or simply starvation, as their bodies failed to utilize nutrients. Comparing this to modern-day diabetes management is striking. Today, we have a deep understanding of the pathophysiology of both type 1 and type 2 diabetes. Diagnosis. We use precise blood glucose meters, continuous glucose monitors, and HbA1c tests to diagnose and monitor blood sugar levels. These are far more accurate and less invasive than tasting urine. Treatment. For type 1 diabetes, the cornerstone of treatment is insulin therapy, administered via injections or insulin pumps. For type 2 diabetes, treatment often begins with lifestyle changes, diet, and exercise, but may also involve oral medications or, in some cases, insulin as well. Management. We have sophisticated tools and knowledge to manage blood sugar levels, prevent complications, and allow individuals with diabetes to live long, healthy lives. Education, regular medical checkups, and a multidisciplinary approach are key. The ancient physicians were incredibly observant. They noticed the cardinal symptoms and understood the importance of diet, even without knowing about glucose, insulin, or the pancreas. Their honey urine was our first glimpse into a complex metabolic disorder. While their treatments were rudimentary, their observations laid the groundwork for understanding this condition. It's a testament to their dedication and keen medical minds that the core principles of managing diabetes, monitoring intake, understanding the body's response, and the importance of lifestyle were recognized so many thousands of years ago. It reminds us that while medical science has advanced dramatically, the fundamental human drive to understand and alleviate suffering remains constant. That's all the time we have for today on Health by the Minute. Join us next time as we explore another fascinating aspect of health, past and present. Until then, stay informed and stay healthy.